As we're talking about the impact from Monday's deadly ambush, it is important to note the hard work of the healthcare workers who treated the officers as they were rushed into the hospital.
Unfortunately, experts say it's these type of tough days on the front lines that can only wear on these type of medical professionals. According to the American College of Emergency Physicians, upwards of 65% of emergency doctors and residents experience burnout, while about 15 to 20% of those professionals met the criteria for PTSD. WCNC Charlotte's Lexi Wilson shows us how Monday's tragedy could impact our local doctors.
Today I spoke to a trauma surgeon who says they're always prepared and practicing to take care of multiple victims at the same time. He calls it organized chaos inside the emergency department, and everyone is crucial, but it does take its toll. Inside trauma centers, the healthcare workers have a unique set of skills to save lives after tragic events.
We are dealing with the effects of gun violence on daily basis.
On Monday, 8 officers were shot while serving active felony warrants. They were rushed to our local hospitals, but sadly, 4 officers died in the line of fire.
Things that these doctors were reaching out to do, you would be grateful. As a community, I am grateful as your mayor.
Cell phone video shows a procession carrying CMPD officer Joshua Ayer's body from the hospital to the medical examiner's office. Healthcare workers lined up, some with tears, showing respect for the officer who put his life on the line.
I think that the healthcare providers were exceptional in their commitment to all of us.
Committed to saving important lives with an outcome they didn't want.
Many people in the medical profession are traumatized by what they see.
Exposure to violence can take a toll on the people we rely on to save us. Studies show all emergency room staff show high signs of anxiety, depression, and PTSD.
Once you're done with one patient, you move on to the next one, and you never really have time to sit down and reflect on what has happened. And you may be, with your family a month later, and it hits you.
Dr. Ajmer Motameni is a trauma surgeon at Wake Med in Raleigh. He says hospitals do offer support to help staff process what they see. But sometimes no amount of counseling can get rid of the responsibility and pain our health care workers feel.
It's hard to lose a patient. Honestly, it's even harder walking in a room and telling a loved one that their family member is not coming home again.
Experts say doctors can be less likely to seek medical treatment for mental health issues for several different reasons, one of them being the stigma around asking for help. Reporting on Atrium Health, Carolina's Medical Center, Lexi Wilson, WCNC Charlotte.